Yeah.
Jenny, if you make the agenda too much bigger, my eyes will blur.
Okay, well, if you need to back it down.
George, Marcia is working off of her iPhone. She doesn't have a computer available right now, so she needed it bigger.
Okay.
Okie
Okay,
dokie,
shall we
Marcia.
call to order? Okay. Good morning. This is May 1st of 2025. Let me call the meeting to order at 10:06. All right. Do we have any of us that do we have any guests that need to be introduced? Or is Leslie with us yet? Has she signed on?
I don't see Leslie yet, but I'll keep an eye out for her.
Okay, because she will need to know. Um, maybe we'll do introductions at the point she signs on or
Yeah,
close
that
to
sounds
that.
good.
Yeah. All right. So let's move down. Adoption of the agenda. We have, I don't know if everyone has received in the email a copy of this, but we have one on the screen.
Marcia, I move to adopt the agenda. This is
Thank
Commissioner.
you. A second, anyone?
Commissioner Adams will second it.
Okay, all in favor of adopting the agenda, say aye.
Aye.
Anyone opposed? I guess not. It's passed.
Okay.
And all right, now we need to look at the meeting minutes for last month. Anyone have any comments they would like to make about that?
No, but I move that we approve the prior meeting minutes as presented, Commissioner Mayor.
Okay. Second,
Commissioner Adams second it.
all right. Any in favor, say aye.
Aye.
Opposed? No one. All right, the minutes are approved. Going down to announcements. I'd like to first say that I have to use my cell phone today, and I have a somewhat unreliable internet connection. So hopefully I will be able to stay in contact at all times. If you hear a chirping in the background when my mic is open, it's my fire alarm that decided to keep me awake all last night. So waiting for maintenance to come and silence it with a new battery. Anyone else with announcements?
Commissioner Adams, make a announcement. As of in the process, I will hopefully be working with a large project down here in Southern Oregon, Jackson County. In Medford, there is going to be a 552 apartment complex going up, one of the biggest complexes ever been built. And I am going to hopefully be working with the organization and the city of Medford to put at least 3/4, if not half, of the apartments in the ADA realm. That's all I got to share.
That's a wonderful opportunity, George. All right. Anyone else with announcements?
I would like to share some things if that's okay, Marcia.
Oh, go ahead.
So we may or may not have an individual who's interested in being a commissioner be here today. Her name is Leslie McIntyre, and I've sent you information, her resume, and how she answered the essay questions. So hopefully you'll have, if you haven't already, you'll have a chance to review that information. And my hope is that if she's still interested, you can vote.
You're muted, Jenny.
Oh my goodness, I said all sorts of things. My apologies. So we may have an individual join us today named Leslie McIntyre who expressed interest in being a commissioner. And I've sent you her resume and how she answered some of the essay questions. So hopefully you've had a chance to look at that. And if not, if you could please look at her information by next month. And if she's still interested in being a commissioner, my hope is that you would vote whether to approve her or not, because we have to have everything in this summer because the Senate vote is this September. So, and also, I was speaking with the executive appointments office with the governor's office, and one of the things they offered to do for us is when they are looking at applications for other boards and commissions, that if they think somebody might be a good fit with our commission, they're going to send them our way, which is great news. And then also, Leslie responded to an email I sent out. People who express interest, who were consumers who express interest in joining the Agency with Choice Consumer Advisory Committee, who were not selected, I sent an email out to that group and letting them know about the commission and, encouraging them to think about applying to join the commission as a commissioner, because it would, if they're interested in advocacy and they are a consumer and they hire in-home providers, this is a good opportunity for them. So this kind of fits in with our strategic plan, and we continue to make efforts in our recruitment of new commissioners. And then this is probably a good place to say a little comment about public testimony. We don't have any today, but I wanted to let you know that when somebody submits written testimony, we will absolutely put that in our minutes as written, but we do need to make changes for accessibility reasons. So that's not done by us, that's done by our SharePoint team. So there's accessibility guidelines. So if something's bolded or in a different color, they may need to change the formatting for that. But we will make sure to include the actual content, what's said in the testimony. And then Paul, I see your hand up.
Yeah, first of all, Jenny, thank you for being proactive and using that opportunity to promote the need for the commission with that group of individuals. Refresh my memory, possibly others. So if we were to vote to affirm Leslie to be part of the commission, then does it go, she still has to be appointed by the governor and confirmed by the Senate, is that correct?
That's correct.
Okay, so the first step is our affirmation, and
Yeah.
then it goes, okay, thank you.
Yep. Also, speaking about potential commissioners, Brett Watkins is on our agenda today, and this would be an excellent opportunity to let him know that we are searching for an individual who experiences an intellectual or developmental disability and receives in-home services, that we are really interested in having representation on our commission. And that's all I have in my announcements today.
Okay, thank you, Jenny. So now we can move on to commissioners' reports. Mary, do you have?
I do. The Governor's Commission on Senior Services met on April the 10th, downtown Salem in the Department of Revenue building. This is one of the meetings that we have in person this year. Also, it was hybrid, so if you couldn't get it down to Salem, you could also listen in via Zoom. Some of the highlights of that meeting, the group was updated by Rachel Kearns Henry, the Senior Human Service Advisor for the Office of Governor Tina Kotek. And We had a strategic planning session also, led by Chair Walt Dawson. We I said thank you to Representative Gomberg, who's been our representative, and he's going to be replaced by Representative Tim Anderson, I believe. And we also had an optional time for going to the Ruth McEwen tribute at the Salem Convention Center. So some also did that toward the end of the day. But it was a very profitable day, and I think it was very appropriate that we had it in Salem, and then we're able to honor Ruth. So that's my report.
Thank you.
Marcia,
Um,
I would like to add something about the
Sure.
Ruth McEwen Memorial. Did I just say Memorial? Ruth McEwen Memorial. I did take some pictures and I will send those to the commissioners.
Oh, wonderful.
And we'll put something on our Facebook, the pictures and just a little tribute to Ruth.
Great.
Thank you. All right, Oregon Disabilities Commission. Mark?
Yeah, I have nothing to report this month, but I will next month.
All right. Now, 04AD Randy is not with us at this meeting. And Paul, Aging and People with Disabilities.
Yes, good morning, everyone. I don't have anything specific to report. I reached out to Matt and didn't receive any input regarding new things to share with you. So I would just say status quo. Maybe one announcement that actually comes to my mind that you may have heard of already. And there's a member of our unit, the Medicaid Services and Supports Unit, Tracy Lerner. You probably all know Tracy or have had interaction with Tracy. Well, as of today, she is the new manager for the Provider Relations Unit. And so we're excited for Tracy as she moves to that new position. We're kind of sad that she's leaving our unit. She's done good work and it's also a fun person to work with. But she's now in a unit that I think certainly Ginny's familiar with and others as well, in a unit that has interaction with the Home Care Commission. So we're excited about that new opportunity for Tracy. That's about all I have today. Thank you.
I would like to add to what Paul said too. I'm not only the executive director of the commission, but I also am the manager over the provider relations unit. So Tracy will report to me. So if you're interested in Tracy attending and learning more about her, I can totally make that happen.
I think we have to do that, Jenny. We gotta have her on the agenda and grill her real good, make her nervous. No, I'm just kidding. It'd be great to have her. Yeah, it'd be great to have this report every now and then, because it is a unit that that does have common areas of their work that do relate to what we do with the commission. So I think it'd be great.
There we go.
I had a question.
Yes. Go ahead, George.
This is Commissioner Adams to Commissioner Johnson. Have you heard anything about, because of what's been downsizing in the federal realm, have you heard anything or been told anything about the state employees being downsized here in the state of Oregon?
Thanks, George. I have not, and I wouldn't typically be a person that would receive that information, but I know that later in the agenda we have a couple folks that are going to be sharing, maybe Max and Jason, about some of the legislative. They would probably be more in tune with questions related to how the state may be impacted or not impacted by things happening at the federal level. So maybe, George, it's a good question, but maybe we could defer it until they're here. They would just be more apt to answer that unless Jenny has information, but I don't have any information to share.
Okay.
Okay, community advisory councils and
Yeah.
coordinate care. Go ahead, George.
Yeah, as far as the CACs on every CCO, they have been keeping themselves pretty busy with all the alignments that's coming from OHA, all the they're doing more work than they have ever done in the past years with all the CCOs on the CAC's front lines, having to prepare with the stuff they got to do with the board of directors, what the OHA is requiring, just a whole number of things. There's a lot of exciting things going on with the CAC right now. As far as the CCOs, they expressed that they're concerned about the Medicare, Medicaid, which direction it's going to go. They're still waiting for the answers of what's going on in DC. Jackson Care Connect, down here, I believe it was last week, had its spring conference. It was a really beautiful conference. We have it each year, or they have it each year. They had a person tell their side of the stories about what it was like to become healthier and not healthier that they went through. And so there was about 300 people that attended Jackson Care Connect Spring Conference. And some of the Care Oregon staff joined in with JCC and in its conference, with including the other providers. Now, what happened afterwards was it was a surprise to everybody that there was what they call a food market that showed up, and it didn't cost nobody nothing. And it was a guy from his garden, and he was giving everybody lined up in a line spinach, broccoli, radishes, tomatoes, lettuce, just out of his own garden. And it was a really wonderful experience. It was a 2-day thing. And so I'm looking forward to seeing what's going to happen next year to this spring conference of Jackson Care Connect again. Go ahead, John. Go ahead, Paul.
So yeah, thanks, George. Hey, do you have any update on your project with the electric wheelchair charging stations? I'm always excited to hear if there's any updates on that. I thought I'd ask.
Yes, it went from 185 to now 200 stations.
That's great. Congratulations, George.
You're welcome. I do know that Prescott Park down here that I was on TV for and everything. I'm now told that now the Parks Department has bought 2 more parcels of land to connect to Prescott Park for people that are with a disability, and a lot of trails for people that is not disability down there. Southern Oregon is seeming to, let's say, grow with my help to the further extent. I'm not quite sure how furthermore it can go, but we're pretty much growing down here.
I think that's great, George. I just want to congratulate you. It's exciting. I would think there's so much opportunity to grow this idea, and I'd love to see, I don't know if this has been done, but I'd love to see some type of APD or ODHS recognition, in a newsletter, whatever. I'm not sure, maybe one of the emails that are sent out that describes the growth of this program. Anyway, great job. It's great to hear.
Well, thank you.
Wonderful news.
Paul, you may want to mention that to Elisa Williams with the communications department.
Okay, I will. I will happily do so. George, would you send me just a brief, just so I communicate what needs to be a brief, like a small paragraph about what the project is, and I will happily pass it on to Elise Williams as something that should be known beyond just the commission. I think about, and I don't know very much about this at all, so I'm speaking ignorantly, which is not too unusual for me. But anyway, you think about like the Portland metro area and all of TriMets and bus stations and things like that, and the population of individuals using motorized wheelchairs, that type of thing. And so it's, I mean, it seems like there would be, and maybe that's already in place and I just am ignorant of that, but it seems like there would be a lot of opportunities to see this program grow and at the same time, recognize that as a commissioner, you're heading this up and it's something that is so much in line with what we want to see happening, the type of services we want to see provided. So, but anyway, George, if you want to send me just a brief paragraph of explanation or description, I'll happily pass it on to Elise Williams, the communications director.
Okay, and to add to that, Commissioner Johnson, Curry County is now interested and has been for quite some time. So Curry County, I guess, wants to be in their county too as well. There's like 1 or 2, maybe 3 on the coast now of the state of Oregon.
This is Marsha Wenzel. I'd like to take off. One moment, please.
Marcia, will you
Yeah.
repeat that, please?
I needed a sip of water. There we go.
Okay.
I'd like to take off my chair hat at the moment and make 2 comments. First, the concept of sharing food that you've produced in your own garden is wonderful. I hope it's contagious. In other states, I don't know about Oregon being part of it. There was a program called Plant a Row where people were encouraged to plant an extra amount in their garden for the purpose of sharing. And anyway, the second point, a wild idea just crossed my mind that it'd be really neat if there could be an adaptation made on all electrical charging units where you charge up your car so you could also recharge your wheelchair. That would give a, a great number available, but hasn't been invented yet. So there it is. Put my hat back on and there. Legislative updates. Do we have Max or Justin available?
They aren't signed in yet. They still have 2 minutes. And if you wouldn't mind, I have a couple of other things to say until they get here.
Go ahead.
Okay, thank you. I sent everybody an email about an upcoming public meetings law educational opportunity from the executive. Let's see, I'm always saying this wrong. The executive appointment office with the governor's office does different educational sessions for boards and commissions, and they're offering 2 sessions. You only have to go to one if you choose to on public meeting laws. And I thought you might be interested because they also talk about when we can and can't do executive sessions. So I thought that would be a good opportunity if you were interested in that. It is a long training. I think it's 2.5 hours, but I'll be attending that. And I think Heidi will be too. This will be our second time because there's a lot of information to learn. But I just wanted to extend that invitation to you as well. And then also to let you know that we are in the middle of bargaining and we will be having executive sessions so that you can learn about that. We usually have Nadja Goli with Department of Administrative Services, who is our spokesperson during bargaining. She can come and give you updates about what we're doing in bargaining and have that discussion. Okay, it looks like Max is here. I just let him in.
Hello, Max. This is Marsha Wenzel, and I'm the chair for today. So would you like to go ahead and update us? I don't think he heard me. You're muted, Jenny.
I didn't say anything, but it looks like Justin and Max are here.
Oh, great. Well, good morning.
Good.
How's everyone doing today?
I'm doing great, Max. Thanks.
Well, hopefully, wherever you are in the state of Oregon today, hopefully the weather is as beautiful and warm as it is at Peninsula Park in North Portland, where I was not too long ago. So, thank you all for having us on the agenda today. Since we last met, and we did meet, I think it was May 3rd, or I'm sorry, April 3rd was the last time that we updated you all. So since that time, we passed the April 9th deadline for getting bills out of their policy committee in their chamber of origin. And it was a really busy week in the state legislature that following week after April's Home Care Commission. There were a lot of work sessions and a lot of work to get some of the bills that we at both Aging and People with Disabilities, as well as the Office of Developmental Disability Services, we're tracking. I'll go over some of the bills that APD was following that were really making that deadline, and then I'll pass it over to Justin to discuss some of the bills that the Office of Developmental Disability Services are tracking that made the deadline. And then we'll kind of come together for a bill that both of the programs are tracking as well, and one that I'm sure that you all on this commission will be following. And then we'll talk about some upcoming dates to be aware of as well over the course of this month, and then of course June, when the legislature is scheduled to wrap up at the no later than the end of June. So with regard to the bills that we're tracking that made it past that deadline, a lot of them actually address services that are in facilities settings. So I just wanted to note that. One of those bills is House Bill 2956. This is a bill that has come up a lot in past legislative sessions over the last, I would say, like 6 years or so. And there's been some advocacy on the part of some adult foster home providers to expand the residency that they could have, the number of residents up to 7. And we know that in other states, there are some states that do have a little bit of a higher threshold for the number of residents in adult foster homes. This bill would actually create a pilot for up to 30 adult foster home providers to put in a request to get up to 7 residents. And so what that would do would be a pilot that would kind of study this over a period of time. And again, it would be no more than 30 providers, and we have over 1,200. Actually, I think we're up past 1,400 adult foster homes now licensed in the state. They're starting to grow. Their numbers are starting to grow again over the last few years. It went to Ways and Means. There will be somewhat of a fiscal impact on that, but that bill is going forward. A bill that didn't have a fiscal impact is House Bill 3942. This bill addresses healthcare facilities, which include nursing facilities that have closed due to financial reasons or for reasons that were not related at all to licensing violations or concerns. And this would allow the ability to reopen that nursing facility with an expedited temporary license until that nursing facility could get cleared by Medicare and Medicaid to accept those residents with that coverage. So that bill, since it didn't have a fiscal impact, it passed the House floor and moved over to the Senate, and it's going to be up for a public hearing, I believe, next week in the I believe it would be the Senate Healthcare Committee. Currently, it's scheduled for 3 o'clock in the morning, but it's probably going to be rescheduled for 3 o'clock in the afternoon.
We'll see. We'll see.
We'll see. Yeah, that's like next Thursday, May 8th. A few more bills on the Senate side. We're tracking Senate Bill 27 and Senate Bill 238. Again, this is a bill that doesn't really touch in-home services, but it does address education, clinical education, and training for direct care workers in nursing facilities and community-based care facilities. This would be kind of a reimbursement for those facilities. I believe it's for $10 million, and those two bills are kind of tied to that. One of the reasons why we're tracking it, not just because of the appropriations, is because it could have a potential fiscal impact on what they, and it's really wonky. I can't really explain it very well, but the upper level payment for nursing facilities, and that could cause a bit of a fiscal impact for our rates there. So we're kind of tracking that bill and see where that goes. That's also in the Ways and Means Committee. And then Senate Bill 34 is the Senate bill that I don't believe we'll have, I think we ended up with no fiscal impact or a fiscal impact that we can absorb on this. And this would create a lot of information for people to look at the ownership of nursing facilities. This is a ownership of nursing facilities, ownership in healthcare. The issue of private equity in healthcare is a really, really big issue this legislative session. And this is kind of like in the spirit of that, but just for the ownership of nursing facilities. That one does have a probably a minimal impact. So we expect that one probably to be moving forward, but we'll keep our eyes out for that. And then finally, the big one, this was a bill that actually had a work session on that Wednesday, April 9th deadline that went from 5 o'clock until close to 7 o'clock in the evening. And that's Senate Bill 739. This is a bill that is associated with the department's Senate Bill 811. And that was a Senate bill that proposed the investment in staff that we could have. So we could look at go-to facilities and adult foster homes that were newly licensed after 120 days of their new license to go see if there's any compliance issues, check on the safety of the residents, and provide technical assistance for those new providers. So Senate Bill 811 got brought in with Senate Bill 739, and there's a lot of other features in Senate Bill 739, such as 24-hour response time to facilities of serious, very, very serious allegations of violations. There's provisions in there for consultants to work with providers who are newly licensed. There's some other provisions associated with facilities that have turnover in their administrators as well. So we're watching this bill, of course, because it does bring in the legislative concept that the department brought forward. And that bill is in Ways and Means. Oh, and one last Senate bill that I think that you all would be interested in because it does indeed affect people getting home care services. This is Senate Bill 1029, and this bill is in Ways and Means now. It got passed out at the final week, and this bill would provide an exemption to a state recovery for under certain circumstances for consumers who had a family member stay in their home and provide care before they became Medicaid eligible for a period of time. This is permitted under Medicaid law that that individual can basically get title to the property or the home of the consumer after they pass away, and there would be an exemption on estate recovery for that particular portion there. So without further ado, hold off on one more bill that APD is tracking, and we'll bring that in with Justin as well. So.
Thank you very much, Max. So you covered kind of the deadlines. I'll just say, Justin with him, he, him pronouns. I work for government relations. And before I dive into a few of the bills that ODDS is tracking, I did want to mention, Max talked about deadlines that have already passed. We also have some deadlines coming up. Session never stops moving forward. It's a lot like a shark. Um, the next big deadline we're looking at is May 9th. That's the date by which in the second chamber we're going to need to have work sessions posted on public agendas. Any bill that doesn't have a work session scheduled by that date is highly unlikely to move forward in any form. And then 2 weeks after that, May 23rd, that's the date by which those work sessions have to have taken place. In between those two dates, on May 14th, we're going to see the May revenue forecast come out, and that is the sort of the budget update that will lead the Ways and Means Committee to start making decisions about which bills have fiscal impacts should move forward. So when we say that most of our bills right now are in the Joint Committee on Ways and Means awaiting their decision as to whether they're going to get funded or not, and then move up for votes by the full House and full Senate. Those bills are likely to sit there for another 2 weeks and not start moving until after that revenue forecast. George, I see your hand.
Yes. Can you and Max tell me why 1029 got ousted, right?
1029 is still moving forward as far as I know.
Okay, is there anything moving against 1029?
I don't think there was anybody who testified in opposition to it, and I don't think there are any other bills that deal with the same subject matter.
Okay, and what about House or Senate Bill 444?
That one we are not tracking all that closely. I know that's Senate Bill 444 is a housing measure. I'm going to look it up really quickly here just to see where it is, but we've mentioned before, it doesn't directly impact APD, so we aren't tracking it all that closely. It looks like it did pass out of its committee of origin on April 9th. So again, this is one that went right up to that April 9th deadline. And so it's now sitting, it looks like it is still at the Senate President's desk, which means that it hasn't yet gone to the full Senate for them to vote on it. And I'm not sure what the reason for that would be. Seems like that decision would have been made by now, but again, I'm not tracking it closely enough to know for sure.
Yeah.
It
Yeah, it
could
looks
be
like it
that-
just, went out
Oh,
of
go ahead.
committee. Yeah, this is Max, it just went out of committee, with a yes vote, of 3-2. And since it wasn't referred to any other committee, it goes to the president's desk, presumably to go to the floor. But maybe the Senate president and or leadership is having some conversations about the bill, but, still alive.
Yeah.
The reason I ask is because everybody's on edge with this 444. They're waiting patiently about which direction it's going to go.
Yeah, and a lot of bills, they just don't reach a final decision on whether they're going to pass or not until closer to the end of session. Whether or not they have a fiscal impact, sometimes, like Max said, there might just be background conversations going on about whether or not it needs more work before it moves forward, or whether there's some other sort of housing reform in the works. But I assume we'll know more by the next time we all meet here. So I wanted to talk about just a few of the bills, and I'll keep this kind of brief, that ODDS is tracking. ODDS is, I'll start with kind of the most directly like in-home services related bills. One of those is one of the bills that's in Ways and Means right now, Senate Bill 538. This is a follow-up to Senate Bill 91 from the 2023 session, which passed. And Senate Bill 91 directed us to create a new Medicaid waiver that allows parents of children with very high behavioral or medical needs to serve as those children's direct support professional specifically. Senate Bill 91 said you can be paid to provide services to your child as long as you are employed by an agency and working as a DSP. Senate Bill 538. Oh, I should also mention Senate Bill 91 only appropriated $3 million a year. So we were only able to serve a narrow slice of the whole pie, I guess, of kids that might be eligible, kids who meet that very high behavioral, very high medical needs rung of the ladder. And Senate Bill 538 this session seeks to expand that waiver so that every child who qualifies can potentially be served by their parents. And the reason it's highly relevant to the Home Care Commission is because that bill also opens up that program so that you don't have to be a DSP. Personal support workers can now also, well, if this bill passes, personal support workers will be allowed to receive payment for providing services to their children. I should also mention this is an age-specific thing. It is already allowable for a parent to be paid to provide Medicaid services to their adult child who is 18 or older. But this is that narrow subset of kids under 18 who have very high-end behavioral or medical needs. So that one, it has a very large fiscal impact for reasons I'll I'll restrain myself and not go into them because I'm conscious of time. But I think the legislature is going to take a look at the budget, like I said, after that revenue forecast comes in and see if they are able to provide funding for this bill to pass. There's a lot of support for it from parents who could potentially utilize that program. There are about 1,500 families in the state, and it's a very active advocacy group. So I'm sure the legislators who will be making that decision are hearing a lot from those advocates. Yeah, and that's all I'll say about that one. I wanted to look at two other bills, and these two bills are actually identical. House Bill 2150 and Senate Bill 133 both moved forward to the Joint Committee on Ways and Means. And what they both say is basically that any organization that employs direct support professionals, including those who provide in-home services, should receive essentially cost of living increases every year that are tied to the consumer price index, which is basically just how we measure inflation. So these would be inflation-aligned cost of living increases that happen every year. Those are, I hate to say that a bill is likely or unlikely to pass, but I think these bills everyone kind of agrees that they moved forward not so that they could pass, but so that they could feed into this larger conversation that we're having about the rate and wage study that ODHS performed over the last 2 years and reported to the legislature about this session. DSPs and the agencies that employ them are just one sector of the workforce that study looked at. So we're having a much broader conversation, but due largely to the timing of that rate and wage study's final report, the governor's recommended budget didn't include any increases for the sort of private agency providers in either APD or ODDS. The governor's recommended budget includes the bargaining pot that you all will be paying close attention to, I'm sure, and also an increase for adult foster home providers within APD, but it didn't include any other provider rate increases. So the legislature is really being asked by all of these different advocates to consider all of the provider types that weren't included in the governor's recommended budget and try to fund them. And that's where these bills come from. So we will probably not see those cost of living increases added to those contracts, but this is a really effective way to kind of wave a flag for the Ways and Means Committee and say, hey, don't forget about these provider types. And of course, we're having a lot of conversations in the background about other provider types that weren't in the governor's recommended budget. It's really clear that the legislature wants to do something to help those provider types. So we're providing all of the data we can to help them make a decision about how best to divvy up their funding. But of course, our main advocacy is behind the governor's recommended budget and primarily those adult foster home and home care worker PSW funding. And the last bill I wanted to mention that ODDS is tracking, well, second to last, Max already mentioned, we have another bill to talk about, but just briefly, I wanted to mention Senate Bill 136. This is not a bill that really impacts the Home Care Commission, but it does impact kind of could impact the broader landscape of providers in the state. So Senate Bill 136 directs the department to do some mandatory revocation of licenses, endorsements, and certifications of providers who, and I want to be clear, this is like a very narrow subset of providers who are acting kind of egregiously bad. This is meant to get at folks who are doing things that are like maybe potentially criminal even. It's kind of that level. Obviously, it's not a criminal bill because we're not the Department of Justice. We can't accuse people of crimes, but it lays out certain criteria for people who are like egregiously disregarding the safety or care of people who are receiving services from them, and directs us to just automatically revoke those licenses. I mention this because earlier versions of the bill, we were analyzing them, talking to the bill's sponsor, and we saw potential for really broad unintended impacts. So we kind of worked with Senator Gelser-Bluen to eliminate that risk, minimize that risk, and really make sure we're just targeted on like the bad actors basically, and not accidentally having to revoke licenses for folks who might be more appropriate for, you know, what we call progressive discipline and technical assistance. Like, hey, you're violating this rule. Here, how can we help you come back into compliance? That's always our preference if it's doable, because we don't want to reduce the number of providers available to people. You know, there are never enough services available for the people who need them. So we don't want to take any large providers off the map unless we absolutely have to. But if those providers, you know, do get their licenses or endorsements revoked, it's possible that their employees might then, you know, be looking around for other work and may very well come over to the home care worker, personal support worker side of the workforce. George.
Yeah, I'm a little fuzzy about this bill that you're talking about. Can you explain to us commissioners a little bit more depth? And is it going to affect the Home Care Commission on how this bill is going to be? How this bill is going to reflect on this committee?
So the only way it would affect the Home Care Commission is what I just mentioned, that if say hypothetically a really large provider who employs a lot of direct support professionals had their endorsement revoked and could no longer get Medicaid funding to provide services, their employees would probably be looking for other jobs. I mean, I assume they would be looking for other jobs in the human services sector. And therefore, they might want to then become home care workers or personal support workers, or maybe go work for another, private provider. That's really the only way I see it impacting the Home Care Commission. And to talk in more depth about the bill, I think, some of the instances where revocation might be mandatory would be, I'm just going to read from the bill here. If a provider denies the department access to a facility or an individual receiving services, or directs an employee or substitute caregiver to do the same thing. So basically, if we're trying to check in on someone as part of our, assessment of is this person's individual support plan being met, and the provider just says, no, you can't talk to them. Like, well, we need to. So this bill would give us really clear authority to say, look, that's not okay. You can't continue to provide services if you're going to do that. And that's again, like I said, it's a really extreme case. So that it's unlikely to be used all that often, but it's really targeted at those worst of the worst types of providers. I'm looking at the time, and I do want to mention the one big bill that is probably on a lot of folks' minds, which is House Bill 3838. This would establish a long-term care workforce standards board within the Department of Consumer and Business Services. So it's not an ODHS entity. It would be in a totally different state agency. And they would be tasked with, I'm going to keep it high level again because of time, really coming up with minimum standards for pay, for training, for qualifications of people who are working in long-term care services and supports. And then they would they would make those, basically they would take their recommendations, and if those cost money, they would run them by probably DHS and OHA, who would be, charged with absorbing like the fiscal impact of any policy changes that this board is recommending. And then all of that information goes to the legislature. I think, Max, I don't know if you had other things to say about this bill. It is still being worked on. They haven't finalized amendments yet. My understanding is there's another round of amendments still underway. I don't have a lot of insight as to what those latest amendments might look like, but I get the impression that they might be pretty minor changes. So the version that we have seen so far might be more or less the version that ultimately goes to the Joint Committee on Ways and Means. But there are still some high-level negotiations about the bill taking place between the governor's office, the advocates for the bill, who is primarily SEIU 503, and some of the outspoken opponents of the bill, who include provider organizations, namely the Oregon Healthcare Association, Leading Age, the Oregon Resources Association, and I think CPAO as well, although they haven't been quite as out front or vocal. So we're, obviously tracking that really closely. There are a lot of questions when it comes to trying to figure out how much will this bill cost the department to implement, because so many of the costs they kind of depend on if this board gets set up and starts making decisions and making recommendations. Those decisions and recommendations are where most of the cost is going to come from, as far as our just like staffing ourselves to prepare to work with this board. That's a little bit more of a manageable fiscal impact. But I think we're foreseeing the possibility that it could cost a lot of money to have this board up and running and making its own recommendations that would have fiscal impacts. So, and all of that stuff is built into the bill too. Like they want us to be advising on like, well, the cost of that idea, Workforce Standards Board, would be blah, blah, blah $1 million. And then and that way they can like go to the legislature with sort of the same types of fiscal estimates that we give the legislature when they send bills that would impact us more directly.
And this is Max. I placed a link in the chat for the bill's main webpage where you can access all the versions of the bill, the amendments. And if you click on the testimony tab on that webpage, we have well over 950 written testimonies that were submitted to that bill, both when it was heard in the House Labor and Workforce Standards Committee and then in the House Rules Committee. So there's a lot of reading on that bill, but it's probably the one we would assume that you all as a commission would be tracking probably the most closely for the commission during this session. So there it is. One last thing too, I know that we were just running over time, is we do have our community partner meetings to do legislative updates. We do apologize profusely about the one that was scheduled back on, I believe, April 16th. What had happened was there was a Zoom outage that affected hundreds of thousands of Zoom users, but thankfully not every Zoom user. So it took until about 12:15, but one of our coworkers, Deb McCune from the Community Services and Supports Unit, was able to get hosting duties and get us launched. Justin and I actually had to participate by like the cell phone to kind of go through. And I will put here, we have our next one coming up on May 7th. Hopefully we won't have any Zoom complications. We have everything set up for that. And at that link that I just posted in the chat for our community partner website, there's also a link to the written update that we also posted for the last update meeting that did have those Zoom complications. Just for anybody who tried to get in and couldn't, we at least have a written update for folks to take away with on that website. Just wanted to pause to see if y'all had any questions for Justin or for me.
Yes, this is Commissioner Adams. That one bill that you and Justin was just saying, that the other board that's gonna be put together, if it's being put together, how's that going to affect the Home Care Commission? Or is it?
Yeah, no, that's a really good question. Oh, Justin, you came off mute. Do you want to start on that?
I think it's kind of to be determined. The board is really tasked with setting standards and not with really taking on any of the work that the Home Care Commission does. It's a little fuzzy still, but certainly there's no, the bill doesn't seek to do anything with the constitutional requirement that the Home Care Commission exist for all of the reasons that the Constitution says it must exist. So, we're of course trying to engage with the governor's office about like what basically asking that same question, George. And until we've seen final amendments on the bill, we're not 100% sure what that looks like. And really, even then, it might just be a question of implementation. Certainly, if this bill passes, both entities would exist, and there would need to be communication between the two of them for various reasons, I'm sure. But the Home Care Commission, the department does get a seat on the board, but the Home Care Commission specifically does not. And, that's something that we raised to the governor's office as a consideration as they continue their conversations about the bill. But I'm not sure how, I haven't been at the table for all of those specific conversations, so I don't know exactly what they're thinking. And sorry, I can't be more specific, but it's a question that, yeah, we're all kind of curious, like, what does that look like once this whole thing is up and running? Assuming it passes. I don't know that it will. Max, do you have anything to add to that? I know that's probably not very helpful.
No, it's yeah, we're just definitely awaiting a lot more details on that. And there will, as Justin indicated, probably be another round of amendments, but they'll probably be more of the technical sort. One other thing to add is from how the proponents described the bill, there would still be collective bargaining for those of the workforce who are represented. It's just that this board would kind of set like a minimum amount of standards, but not to supplant any sort of collective bargaining arrangements that are already in place, at least for direct care workforces, including home care workers in the consumer employed provider program.
Jenny, I would like to recommend as a commissioner that one of us commissioners be a part of that new board being developed. Or at least have a seat.
We've recommended that, George. Ultimately, it will decide on legislation will decide whether we have a seat on the board or not, but we've made it known that we are interested in that.
Okay.
Is Marsh was speaking. So its intent is to be a free-floating island and make decisions. They're not seeking to bring it out by conversation with the groups that they're making decisions about.
So the board has specific membership mentioned in the bill itself. And sorry, I don't have it pulled up at the moment. So I can't read off specifically what all of the membership is, but it does include folks who are providers, both private providers and, representatives of like the PSW home care worker class. Sorry, my computer never pulls up the documents that I want to look at as quickly as I need them. But it includes folks from agencies who would be impacted, including Bureau of Labor and Industries, DHS, let's see here, 2 members who represent the interests of individuals who receive services provided by the home and community-based services workforce, 3 members who represent employers of individuals in the home and community-based services workforce, and 3 members who represent the workforce itself or labor organizations. So there are basically the agencies and the workforce are pretty well represented, but it's both sides of the workforce, the private employers and the non-state employees that you all interact with.
Agency with choice, is that on the list?
Not specifically, but it's possible that an agency with choice provider would qualify as one of those. Let's see here. What was the exact language? I
Maybe the employer.
Where it was, but the folks who employ members of the home and community-based services workforce.
Yep. Yeah, that would be it.
Thank you.
Yeah. And I'm actually running late for an 11 o'clock that I need to run to, but hopefully if there are more questions, Max, can you stay on for a few more minutes?
Oh, absolutely. Yeah, my 11 o'clock got canceled, so I'm here.
Great. Thanks, everybody. And yeah, always feel free to reach out if you have anything else for me specifically, but you're in good hands with Max.
Thank you, Justin.
Thanks, Justin. Yeah, any other questions about session? And again, the last link that I dropped in the chat is our community partner and community engagement website. And most of the materials on there are associated with the legislative updates that we bring to anybody who wants to come to those meetings. We hopefully will not have any more Zoom outages occur, but if we do, we'll definitely get the problem fixed within the first few minutes so that we can get that meeting up and running.
we experienced the same problem, Max. So we know exactly what we had a few classes running at that same exact time. So we know exactly what you're talking about.
Yeah, I talked
That-
with Angela at Oregon Care Partners, and they were afflicted by it too.
Oh,
And
it was crazy. Yeah.
yeah, yeah. Well, then I'm seeing nothing, no hands and nothing in chat. Thank you all for again time on your all's agenda today. Hope you have a wonderful May Day, and we look forward to talking with you next month in early June, when hopefully we'll have even more information to report back.
Thank you, Max.
Thank you, Max.
Max.
Okay, to Roberta Lilly and the first aid report.
Okay, everybody. Hello. Glad to be here today. I want to share with you how things are progressing with our CPR first aid. And would it be okay if I shared my screen and I can maybe show you? Would that be okay?
Yes, Roberta.
Okay,
Sure.
thank you. All right. Okay, it's a big report, but I'm just going to hone in on a few numbers on it. So bear with me here. All right, this report has a lot of data on it, but I'm just going to focus in on the CPR first aid report. So let me zoom in and get down here to the bottom row. And this is our first aid CPR first aid attendance records. Our most recent data goes to March. And you can see this top line right here is 42, and that's the number of people in March that completed their CPR first aid online. So that is through our virtual CPR first aid contract with Emergency University. And in March, we also had 20 people in the state that took their CPR first aid in person with an instructor in their county. So our total number of providers that earned their CPR first aid in the month of March was 62. So that's, as you can see from month to month, look at those numbers. They're pretty high. We had a big whopping month here. So overall, oh gosh, this kind of blocks my way here. So overall, what does that look like for our CPR differentials? Well, as you know, if one of our providers has a CPR without one of our OHCC certifications, they get to earn 25 cents more per hour. So we have 1,143 students or providers earning 25 cents more per hour because they've taken a class and they have turned that into us. So you'll see here some interesting numbers for March. New people who are home care workers right here, that's 67. We have new PSWs, we have 17 of them, and we have new PCAs, personal care attendants, earning their CPR. Now, we also have an additional 6 for renewals. These are people who already have a CPR. They came back again 2 years later to renew. So 6 home care workers, 1 PSW, no PCAs. We have to subtract out of these numbers people who are no longer in the category of CPR differential. Why did they leave? Well, it's a combination of different things. It could be that their CPR first aid expired, but they did not renew it for whatever reason. They may not have renewed it because they left the program altogether. They're no longer providers. They may have inactive, they just became inactive providers. They may be active providers, but they let their CPR expire just neglectfully. Okay, they weren't paying attention and they just didn't get it renewed in time. Or they've moved out of being a CPR differential and they've moved up into being a professional development certification, or in some cases an enhanced. So once they get a different certification, they no longer earn the CPR differential, which is a standalone 25 cents more per hour. So it's either this or it's that. It's not both. So so to date, we track that and we have 1,143 individuals earning that in March. Okay. So our contractor is emergency. Well, first I'll pause and ask, do you have any questions regarding those figures? The process. Okay, are we good there? I do want to share that we meet, when I say we, myself and Candace Morley on our team, she manages behind the scene a lot of the work that goes into getting our students one by one into a CPR first aid class. She manages this on a daily basis. And as you can see, that's a lot of students. And we have to gather a lot of information from them up front before we can get them to the right town, right place, right class, all that. And we meet with our contractor for the virtual training regularly, quarterly. And our last meeting, we discussed how can we reach other populations? Well, they do offer CPR first aid virtually in Spanish. So I'm working with them on seeing if we can get a work order written up. And having our contract does allow for additional work orders. So seeing if we can move in the direction of offering a Spanish CPR first aid virtually. Additionally, they have in the past taught a Chinese class, which we teach in Chinese. So they have to double check to see if they have that material in an updated format. And if they do, they're going to let me know, and that might be another option for us. Currently, all of our non-English speaking students that need assistance in CPR first aid, we schedule all those in person. Okay. And I see that George has his hand up. Did you have a question?
Yes, this is Commissioner Adams.
Yes, Commissioner Adams.
I have a first thought.
Sure.
Yes.
Yeah, absolutely.
Have you considered maybe combining CPR with autonomic dysreflexic class together? Or would you consider dividing both classes separately, since they're both related to medical?
Thank you for bringing that. That's a great question. The CPR first aid instructors are certified through different programs, and they have a curriculum and certification program outside of the Oregon Home Care Commission. And so the curriculum that they train is predetermined by the body that they're licensed on. So we're unable to offer or suggest additional training material during those courses. They're only allowed to certify based on their own instructor license. So, but could we train next to it? Yeah, we do that. We do schedule the CPR first aid course during our professional development certification conferences uh, as much as we can. So we go to a month, we go to different counties, and we dedicate time for the CPR first aid course. And then most of our students stay, and then that afternoon or that morning, they sign up for other classes, and we could pair it with classes that offer training with that topic. That topic is being trained, but it's inside of the ventilator dependent quadriplegia course. We would need to incorporate it into the professional development certification course, and that would be very simple for us to do. We are getting ready. Well, that's on my agenda to share, so I'll make a note to bring that up in just a minute. We're going to be updating some of our coursework, and we can definitely incorporate that into the professional development certification course, and then couple it with training, but not put it inside of the CPR first aid training. Okay. Kind of
Okay.
accomplish the same thing, but not inside the class. All right.
Okay, this is
Okay.
curious.
Yeah, thank you. Thank you for bringing that point up. Um, if there's no questions with the about the CPR first aid program that we're using, I, I want to go ahead and while I'm here, share a few other points about our training program with you, if that's okay, if I have a few minutes here. Okay. We are, as I mentioned, we are training CPR first aid for the non-English providers in person, and that would include Russian, Spanish, Arabic, Somali, Vietnamese, and Chinese. We oftentimes will have to take interpreters into the classroom because there does tend to be a shortage of instructors that speak those languages that are training directly. It does seem to work out fairly nicely for us to have the interpreters in the classroom. We have not had any problems with that. Okay. And switching topics, other important developments that we've done outside of the CPR first aid include a big project that we have launched and are ready to give you some reports, and we have further reporting to do on this and that as we go, and that is the Serious Incident Prevention course. And the Serious Incident Prevention course is a core course, meaning it is a requirement for anyone who is earning the professional development certification. So now all students who are earning the professional development certification must take this course. Okay. And the course, so far, we have 319 providers registered to take the course. We've had 65 completely finish it. All 319 are in the process of taking it. And it is a new style for us, and it's a new style for our students when it comes to the professional development certification. Most of our classes are in the professional development certification are only, straightforward. They're either on demand, meaning they take them at their own pace, or they're on a webinar where they meet with the instructor. This one is what we refer to as a blended model. It's both. You must take part 1, which is online, and you take it on your own, and you go through all of the sessions, or what we call all of the parts here. So we have different topics that the student would go through. So they're going to finish this one first and go to the urinary tract infection. Then they go to the falls, then the wounds, sepsis, medication management, and behavioral health crisis, and conclusion. And after they finish all of those, then they would go to the second part. And the second part is where they register for the webinar. And the webinar is taught every 2 weeks or twice a month. We are going to continue with twice a month for at least the rest of this year. And because we have high volume of people that we need to move through. For example, this last week, we had, I think, 60 people in our classroom. And our style in that webinar is really active. It's not really lecture style. We're taking the information that they've learned in this online training, and we're putting it into practice, drawing from their information that they've learned. We're trying to keep them active and interactive. And so we're doing breakout sessions. We're doing whiteboards where they're thinking and pulling from their own personal experiences and sharing with each other. And we're having to be really thoughtful because our audience is very large. It is much different than when we're working with a smaller group. So we have had 3 webinar sessions. We have changed it. We knew that we would change it a bit, and we thought by the 3rd time we would be solid. We probably have 1 more to go, and then we're going to be onboarding our contract instructors. We will be training our non-English students in webinar for a bit of time. So our first instructor coming on is bilingual English Russian, and our second one coming on is bilingual English Spanish. So those two will come in first. So those will be the first two languages that we'll train this class in. And then we'll move into our other languages that we train. So it does take a bit of work for us to train in those other languages and to get our materials translated as well. So we're working in that direction. So I want to give a big thank you to our two learning development specialists for developing the course. We did this internally with a tremendous amount of support from our subject matter experts in the Aging and People with Disability, the Office of Developmental Disability, and the Oregon Health Authority. They were able to support us throughout the development of this course on all of these very important topics. And we've had some really great conversations with providers. And we really felt strongly from our perspective on that first opening of the class. We go over the important skills of the home care worker and the providers on focusing on what is important. A value that's important is your communication, your relationship building, your observation, your awareness of being educated on the outcomes of any of these things, and knowing what your reporting requirements are for your position. So we cover all that right up front. Have they heard it before? I hope so. I hope it's not the first time they hear it, but they need to hear it again. And we're clarifying, we're putting scenarios in place. So we're hoping that we hit the mark. We will be bringing back some data in the future to you so you can see some of the surveys that we've done with our students that have completed this course. Any questions about this course?
I have one more question.
Absolutely, yes.
This is Commissioner Adams. Have you thought about maybe, I don't know if you've got this on your website, but do you put these in PDF forms for state providers and PCWs to go over and look over in their PDF form?
Thank you for bringing that up. I didn't mention it. The learning management system in which they go on to take this class has the ability for us to upload materials, and they can go on and view the materials right there on our website, or they can download the materials. We oftentimes have students that call us up or email us and saying, hey, can you send me the materials through the mail? And we always say yes. And we would, in that case, send it to them. But when we put those materials up, they are in the PDF form. Yeah. Okay. All right. I looked this morning, the number of providers that have signed in and registered on our learning management system on our learning website. We have, to date, we have 8,374 students that have, since we opened our PACE, we call it professional and continuing ed, 8,374 students have registered themselves. Last month when I was here, I asked for approval and commissioners, thank you for the approval for the safety in motion. I know I had said I was going to send you the actual safety in motion videos, and I haven't done that. I haven't been able to figure out how to do that. There's a copyright on it, and I need to work with the owners of that to figure out how to get it to you. So I might be giving you a more in-depth scenario of the courses. I might wind up needing to do it that way, but I need to have a meeting with SAFE first to share with that. So my apologies for the delay of that, but I did go to the DDMH committee and they also approved it. So we're very excited about that. Our next step is now to do a subcontract with SAFE for this course, and then we'll start moving into our program. A couple of developments that we have done in 2024, in the late part of 2024, is we added the Russian version of the Elevate newsletter. And so we are able to offer that out to our Russian speaking providers. And we're continuing with Spanish, and we're utilizing the translator program through the publications department for both of those newsletters. And in the fall, we'll be moving back to a program we used to do, and that was a partnership with the publications department for the Elevate newsletter. And that comes out of a need for the new ADA reading ability policies that are going into place in 2026. After consulting with them, we feel like the best possible outcome for our newsletter is to turn it kind of back over to the publications department. And it'll relieve us, it'll be very efficient for us. We'll still put together all of the articles and have that responsibility, but we'll partner with them and they will basically put the package together, ensure that it is ADA accessible, and then we'll work with them on getting it distributed. The biggest exciting thing that is going to be happening in the training unit is right around the corner. We've been waiting probably 5 years for this, and that is we have a new way to pay provider stipends. And we refer to it as the JV system, but it should be the varsity system, but it's the JV system. And that will be happening very soon. They're in the mainframe, which is our computer, the team that works on our main computer system. They're testing, they're doing some final testing now. And so soon we'll meet with them and we'll be able to go live. I don't have any start date, but it'll be in the very near future, and we'll move our entire system into this new pay program. And what that means for the providers is that if they take a class today, they would probably have a check coming in the direct deposit of their, same as their payroll, probably by next week. So super fast. Right now it could be 6 weeks. So it's going to be, we're going to have some happy campers once we get the JV system in place. We haven't announced that to our providers as a whole. We'll put that out in the Elevate newsletter once it's up and running. We do share that sometimes with students if they are asking, you know, if they're having some problems with their address and whatnot, we'll say, well, guess what? It's going to be changing. It'll be a lot faster coming up soon. So they're excited about it too. I think lastly, I wanted to update you again on the mental health first aid in-person program. That is going well. We're offering English in person this coming month. Well, actually next week, we're having some interpreters in that English class for our a couple of Spanish students. It's the first time we've been asked to do that. So 2 of our locations, Woodburn and Newburgh, we're going to have Spanish students with interpreters, and we're ordering our books in Spanish for them. And but as we're thinking, gosh, maybe we need to start recruiting a Spanish speaking in-person instructor. So we will probably be looking into that for a need here in Oregon. We do teach it online in Spanish, and we teach it in English online. And that is a very popular class. That class, we're teaching older adult mental health first aid in person. We're teaching adult in person in English. And like I said, we'll have our first 2 Spanish students coming in this coming week. And we are teaching a very popular one, and I'm very excited about this one. It's for youth focus. Youth definition 12 through 18, mental health crisis. So what a great win for providers who are working with the youth. And it's not just for when you're on the job, it's for your whole life. If you're working with working with 12 to 18-year-olds, this will help anyone who is working with youth who may be in a mental health crisis. So it really, providers come out of those classes feeling empowered to know what to do if they're with somebody, and they have some tools in their toolbox on how to help people. We're also still working in recruiting instructors for the Vietnamese courses, and we have several people interested in training for us in Chinese, and so we'll be being able to offer them some contracts. We're still looking for some Vietnamese instructors. And we have a Somali instructor, but we're going to be recruiting for that as well. So I think that's all I had on my report. Oh, I want to welcome back. We've been running with some staffing shortages for a few months. And we've had the staff, but they've been on leave. We're welcoming back Pashana Zuniga. She's our certification coordinator, and we got to see her little baby girl this morning. So she's back this week. We're so excited. And so that Candace has filled in for her. She'll stay with us, of course. So and then we have Brenda Hoffman, who is our main office support for phones and emails. And she and Joanna work together, opening Zoom classes and doing all of our administrative support for our team. So now we have two of them on, and so we're happy to have them back on board. So that's all my updates for today.
Roberta, did you mention Power Hour? I had to
Oh,
step away for a second.
Thank you. No, I didn't. I have one more thing to talk about. We have launched what we are referring to as Power Hour once a month. It's Wednesday from 11 to noon. And we can send you the link if you're interested in joining us. We'd love to have you. We'd love to get your feedback. We're in collaboration with Carewell, SCIU 503 RISE partnership. And how we have kind of divided the floor, I guess you might say, is every other month OHCC presents, and every other month Carewell presents. And this last time Carewell presented on benefits and how to access the benefit program, how to sign online, that sort of thing. And the month before, OHCC presented on the training program. So I think this coming up in May would be OHCC's presentation. We are blasting out. We're trying to reach people, and we know that over time we'll start building an audience. It always takes a little bit of time to kind of build and get into people's routines. In March, we had 197 people register, and we had 110 people attend. And in April, we had 188 people register, and we had 136 people attend. So it's already kind of moving up a little bit. And we've got a lot of positive feedback from it. So we'll be posting all of that on our OHCC website. And so if anyone missed, they can sign on, and that'll be up very soon. And they'll be able to sign on and watch the video of it. We'll be getting out a schedule of the topics and the time, and we'll be posting that. And we can let you know when that goes up. We do have an article on it in our Elevate newsletter, but we'll also be posting it so that people can plan ahead and see what's coming. Okay. Thank you, Jenny, for reminding me about that.
Thank you for your great work on that, Roberta.
Oh, thank you, Jenny. You're welcome. Is there any questions for me?
There's one more question. This is Commissioner Adams.
Yes.
Isn't it 8,000 that you had just said? Was that 8,000 within the state providers, or is that 8,000 within the PCW state, did everything together?
Yeah, thank you. Yeah, that's a combination of home care workers, personal support workers, and personal care attendants. And the nice thing about our website is that when they register, we're able to identify them. And so we know that of that breakdown, the majority are home care workers, which is not surprising to me. That's always been the majority of our training program. 5,344 of those are home care workers. 1,878 are personal support workers, and 222 are personal care attendants.
Oh,
yeah. And when we train our classes in other languages, we do everything we can to reach out to people who speak other languages to the best of our ability, and try to invite them to class via email, and provide them with the link, and in their language, invite them to come in, and just give them the link and have them come in. And then we worry about getting, whoever comes, well, then we worry about getting them registered afterwards. So that has really helped us. So we have been able to build up our Chinese student body that way. And we've been able to build up the Spanish student body that way.
Okay.
Okay. Uh, thank you, Roberta.
Thank you.
And yes, could you put the agenda up again, Heidi? Thank you.
Roberta, could you quit sharing, please?
Yeah, I was just trying to find my little
Oh,
button. Oh,
it's
there it is.
okay. Thank you. No,
There
it's
it is.
fine. Don't worry.
There we go. Okay,
Okie
thank you.
dokie.
Thanks. Thank you, everybody.
Bye now.
Bye.
Oh, there. Can everybody see that?
Yes.
Okay.
Uh, let's see. George's picked. There we go. We are a bit behind. Do we have Cola Bickford
Yep, I'm here.
in wings? Oh, there she is. Okay. Would you like to go ahead now?
Sure, I'll go ahead and steal the share from you. Alrighty. So what I've got for you guys here is the March month-end financials. So hot off the presses. So this puts us 21 months in, 88% of the way through the biennium. So just three months left. Let's see, overall, our total budget has not changed. We're at still that 11.8 million.
Cola, I'm going to
Oh,
interrupt real
sure.
fast.
Yeah, please.
Marcia, can you see what's on the screen? Does Cola need to make his
I was just
handout
going to
bigger?
ask for an enlargement. I'm working off my cell phone, and that would be very helpful.
Is that helpful?
Yeah, a little bit
better.
more. A wee bit more if you could. Oh, you could go back down
Back at one? Okay,
so I can see all the. There, that's pretty good.
cool.
Thank you.
Yeah, no worries. So yeah, total budget has not changed. We're still at that 11.8 million. Our total spending through March is about 9.3 million right there, of which about 6.5 million is state dollars and 2.8 is federal dollars. And with 3 months left in the biennium, we're expecting about 1.8 million more in spending. Altogether, that would leave us about 1.4 million under budget at the end of the biennium in state dollars, the GF and OF there, general funds and other funds. So that has grown from about 1.1 million from the last time I spoke with you guys. So that has increased by about 300,000. The bulk of that increase and significant chunk of the overall savings is largely attributed to the better federal match we began claiming partway through this biennium. Let's see, and some is also attributable to some lower spending in services and supplies, mainly in professional services.
May I, this is Marcia Wenzel. May I interrupt you with
Sure, please.
a question? Is the federal funding that we were to receive up to date? Or are we waiting for some to still come in?
All of this is up to date. This is all current.
Okay, thank you.
Yeah, no worries. So let's see. Yeah, you'll see here for what we had budgeted in federal funds, our burn rate is close to what we had budgeted originally, but that's totally okay. We do have plenty of extra federal funds allocated in the overall APD budget this biennium. Scrolling down, I might have to zoom out a touch on this one, but hopefully these visuals will still be visible. So we've got here's the past 6 months of spending broken down by our budget categories. The low spending you see in November there was due to a miscode that hit in August that was corrected in November. So actually November spending was more in line with these other months. excuse me. For March, spending came in around 470,000. Our admin spending was down slightly, while our training stipend came in a bit higher than last month. So blue is the admin, green is the training stipend. Alrighty. So this guy here, this is our services and supply spending over the past 6 months. You can see that March spending came in a little bit lower. The bulk of that spending was still in professional services, the the golden brown, I guess. I don't know what you'd call that color. But but that came in a little lower as well. Spending in other areas, you'll see a lot of these other colors here, pretty minimal in March, but we did get some spending in Attorney General legal fees, which we usually do not see, which is that orange right there. Going down here, we did add this in recently, so this is kind of a recent addition. We've begun tracking our spending in sign language and interpreters. Oh, sorry, I see a hand up, Commissioner Johnson.
Yeah, hi, Cola. Could you go back up to the other bar chart?
Sure.
Why are 2 of the months a little bit below 0? Just an explanation. Yeah.
Yeah, this one sometimes, as with, let me scroll up to this other one, how this one's lower, that was something getting backed out, essentially a miscode. I can't say specifically what those are, but a lot of times it's something like that where a transaction has to get backed out or something gets corrected.
Okay.
Can you enlarge again, please? Thank
Sure.
you.
Let me get back to the little area here.
Thanks.
Yeah, no worries. Yeah, so this chart here, we begin tracking our spending in sign language and interpreters. So this here is actually a subset of agency program-related services and supplies, which is part of our overall services and supply spending. Sorry, I know I'm bouncing around here a little much. Here we had some higher spending in February. It was offset a little bit by minimal spending in March. This can be due to timing of when we receive and process invoices. So we may expect to see some higher spending here in the next month or two. Let's see. Our first and biggest budget area is the admin area. So that makes up about 9.7 million of our, oops, I didn't mean to highlight all that. There we go. 9.7 million of our overall $11.8 million budget. Burn rate here is total funds right here, about 78%. So we're well under the point where we're at in the biennium. We're 88% of the way through the biennium. But of our total budget in this area, we've only spent about 78%. Let's see. You'll see here that our federal spending burn rate has already gone over what we allocated. And again, this is totally fine. We've got plenty of budgets in the larger aging and people with disabilities budget, so no concern there. And again, that's helped with saving state money, so we are in good shape. Looking at our kind of more specific budget areas within the admin area, seeing how I can kind of capture as much of this as possible. Let's see, I guess I could just kind of scroll back and forth as I go through it. In the main admin portion of our admin budget, our burn rate is again well under where we're at in the biennium at that 78%. Training, we're at 53%. That's well under where we're at. Let's see, and spending in these other 3 areas has been relatively negligible. A little over 36,000 between the 3, and their overall budget's about 160,000. So well under budget there. What I have next is another chart here. Let's see. Maybe that zoomed out too much. Okay, maybe it'll be the past 5 months. There we go. So here within our admin budget, we have our personal services and supply spending. Personal services is the dark blue bars and the trend is the dark blue line. Services and supply spending is light blue bars and light blue line. Again, this this negative below zero was a correction of the miscode. If we remove that, the S&S spending would be flat, if not even trending down slightly, given how high it was at the beginning of this time frame. Let's see, personal services has remained flat despite a approximately 6.5% cost of living adjustment that hit in January. The increase from this was offset by employees either going on leave or leaving state service. So once employees come back and open positions are filled, we will expect to see just a slight uptick in personal services in the next few months. Here, so this chart just kind of shows the fund split that we've been getting. This is, I can't remember exactly when it happened, when we started getting a better federal fund match, but that seems to have leveled off right around 40% federal match in payroll. So it's been huge help in saving state dollars there. Let's see, what do I have next? Okay, next we've got our developmental disability and mental health budget. Overall, our budget here is about 780,000. We are a little overspent in that. We're at 92% spending total funds. But again, we've got plenty of savings to cover that from other areas, so not a concern. And that budget area is broken down just into these two specifically. So the vast bulk of it's in the employee resource connection, and then just a small $5,000 in the DD and MH committee, which has not spent anything there. So yeah, bottom line, a little overspent, but no big concern there. Plenty to cover that from other areas. Next budget area is traditional health workers, much smaller budget area, $88,000 in total budget. And spending there only 38%, so well under budget. I think I have two more areas. Yeah. So next one, another relatively small budget area, enhanced and exceptional workers, budget 163K. Again, the burn rate's been pretty low there, so well under budget. And last area I have is the training stipend. That's a more sizable chunk, a little over $1 million in a total budget. And we're tracking kind of closer to where we're at in the biennium there at about 82%. So still slightly under budget, but yeah, pretty close to where we're at in the biennium. And that is what I have for you guys. Any questions I can answer?
Yeah, this is Commissioner Adams. Is that when you said stipends, is that the stipends for the commissioners or stipends for the people that are taking classes?
That would be the training stipends. I don't know, Jenny or Heidi, if you can kind of explain the stipends more.
I'm sorry, will you please repeat that? What was
Kind
your
of
question?
what comprises the training stipend budget area, more like
So
what
the
the stipends
training,
actually are.
yeah, George, those training stipends are the stipends that providers get for going to our trainings. These are not the commissioner stipends.
Okay. One more question. This is
Yeah,
Commissioner
please.
Adams. When will you be coming out with April's numbers?
April closes, usually months close a couple weeks into the following month, and then, it can take a week or two to fully build everything together. So should have that pretty much end of May.
Okay, and with the grants that are being cut off for nonprofits and stuff, do you foresee the money from the federal government being cut off for the Home Care Commission?
I wish I had an answer for you there. Fortunately, I don't think I know any more than you do on that front. Wish I had some more info for you on that though.
Okay,
We should have put in our budget to purchase a crystal ball.
Well, we've got lots of savings, so if we got if there's a biennium for it, right now's the time for that crystal ball.
This is Marcia Wenzel. When I just running through my head the burn rates, some are up and some are down. I bet you if we averaged it out, we're pretty on target.
Yeah, we're a little under budget overall. The total burn rate, total fund expenditures to date. Yeah, right now we're under budget still. We're about 88% of the way through, but we're only at 78% of the total budget overall.
Amazing.
Yep. You guys are one of the smaller concerns in my larger budgeting area, so yeah.
This is Commissioner Adams again. I have an idea that I want to do since we're on this financial thing. Jenny, how could we, this idea that I want to come up with, if or somehow, can us commissioners come up with an idea to, not to congratulate a consumer, but to award a consumer for keeping their employer as long, an employee or as long as they can have them. Can we have something set up that way, or do you think it might be a really hard thing to do or keep track?
I think that would be very hard to do and keep track of.
Okay.
Do we have more to see, Cola, on the
That was everything I
recording?
had for you guys.
Okay. Okay. Well, thank you for bending your brain to get all that together.
Yeah, happy to. Thank you all for your work. Appreciate it.
Okay, thank
Stop
you
my
so much.
share there. Yep, take care.
And now I believe we are at our favorite part, break, 11:50. Okay. All in favor of a break?
Aye.
Okay. No one else? Ooh, okay. Would uh 10 minutes be okay with you, George?
That's fine.
Okay, because instead of the 15, since uh, others seem to want to uh, get our meeting completed. So let's take a 10-minute break. And the correct time now is, okay.
It's 11:58, but shall we just call it 12 and be back at 12:05? 12:10, Marcia, does that sound good?
Yes. Okay.
Okay, we'll see you at 12:10, and everybody, the recording will stay going. People will be able to hear you or whatever, so just know that. Thank you.
Thank you, Heidi. All right. Off we go.
I'm back. 12:05.
George, we're starting at 12:10.
Oh. Okay.
Hello?
Hi.
Did anybody else appear?
I'm here.
Oh, okay.
I'm back.
Okay. Well, okay, shall we roll? Um,
Looks like we have David here.
okay. That's good because he's next.
And David, when you share your screen, will you enlarge it so Marcia can see it on her phone?
I didn't know I was supposed to talk.
Is that a problem? Since when is
Oh,
that a
wow.
problem?
Oh no, I can't believe this is happening to me. My boss didn't tell me anything about this. Wow. Hi, everybody. I am the David Scott Vining, your friendly neighborhood OHCC program analyst. I'm here to talk about the campaign a little bit. Last month I showed off the website, but I'm going to talk a little bit more about some of the ads that are going on today they've started already. So you may have actually seen some. I have heard from some of the staff at OHCC that they've seen the ads. And so that's good news, but we'll get into this. So the campaign launched on April 2nd, and is going really strong so far. Before we get to what it looks like, let's just talk about the reasons why, right? Obviously, we know that the workforce needs to grow. Some
A
estimates
little
say,
larger, please. Enlarge, please.
I don't know if I actually can since it's a PowerPoint.
Oh, okay. It's all right.
Give me
Okay.
just a
Fine. Fine.
Oh, look at that. That's cool. That's a new tool I just found. Oh, whoa. That's all. My bad. Sorry, everybody's gonna see me just get distracted now. All right, so gonna talk about the ads really quickly. We know we need about 70,000 more workers just because of aging, people qualifying for services in new ways, all of these things. So we need to grow this workforce, and because of that need, we have been really working hard on this campaign. Jenny basically gave me a whole nother job on top of the other 4, 5, 6 that she has given me before. But it's been fine. It's worked out well, and I'm super excited about this. I think that it's gonna really help us and bolster this workforce. But we also have a secondary reason for this. We really want to lift up the visibility and the value and respect that providers receive, right? We want our state to recognize this as important work to help in the community, to that it brings value into people's lives and to our community. It helps people stay independent in their own homes to where people feel hopefully the safest and the most welcomed, right? So we want to make sure that as we're trying to show that we need this work, it's needed because it's valuable and it brings something with it. So this campaign has the goal of recruiting the providers that we support here at the Home Care Commission, home care workers, personal support workers, personal care attendants, and even the subgroup of personal care attendant or personal support workers who are job coaches. But a little subset of it also is recruiting more adult foster homes, both for APD side and on the OHA side. This has been a long thing. It was really fast, but it was a lot of work. So they did start with doing some research and discovery to find out some information. As you know, we did the soft test back from January through March, which is where we were testing out different messages in our pilot counties of Deschutes, Crooks, Jackson, Jenny, nod your head if Jackson, and Jenny doesn't remember, Coos and Clackamas. So we tested some messaging there, saw a couple of different ones that worked really well. The benefits, talking about the benefits, was really important, especially flexible work hours, which is something, right, that we communicated it would be decided upon with the consumer. And then also that this is meaningful work. So we took those messaging and then moved them over into some larger full-fledged ads. Those soft messages were tested in digital media and on Facebook, social media stuff, right? Google searches, Google ads, things like that, to help us understand what would be the best messaging to get and use. Then we just started making tons of material, and I'm going to show off some of that here in just a minute. Big campaign strategies for this. Because this is a statewide strategy, we're using lots of different things, but also knowing that we have to reach certain areas in specific ways, knowing that rural Oregon communicates differently than cosmopolitan Oregon, right? So lots of decisions about using print media, making radio ads and commercials to reach this particular demographic. Obviously using transcreation of material, which is different than translations, right? Translations tend to just do word for word things instead of conveying the broader message and value of the language. So working with transcreation in 10 different languages, we've been getting that. Those aren't all launched yet. Those will be slowly rolled out throughout the year-long campaign. But right now, English, Spanish, Russian, and I want to say Arabic also are already available out in the wider public. We also want to do some stuff where we're engaging with advocates and allies to give them the information on how they can spread the message for people to become providers. This also includes social media influencers who might talk about the value of this work. I mentioned earlier all of the website or the languages that will be going on. The website is actually available in these languages already. So our OHCC workforce.org website got a full revamp, looks super pretty now. Not that it didn't look pretty before, but now it's got a facelift. Botox. I don't know. Anyways. But the full website itself is now transcreated into Spanish and Russian, as those were the identified languages with the most that providers use the most other than English. And so we made sure that the entire website was translated into those languages, and then quick snips of the basic information that anyone in the other languages would need to find. They can go to the website and then get there really quickly. All of the materials that we'll be sending out links directly to the language portion of the website. So for example, right, someone in Arabic gets a flyer, they scan the QR code, and it takes them to the Arabic version of the website. Lots of advertising channels. We're looking at going to job fairs and sponsoring events. In fact, I have one coming up later on in this month where the Oregon Rural Health Association is having a conference for a few days. And so I'll be going there to spread the word about this type of work. But we're also doing digital ads again. We saw a lot of activity and movement because of the digital ads. So we're going to keep that going. Again, ads on Facebook, ads on Instagram, ads on YouTube, moving picture commercials where that's going to be playing there. I don't know how often you guys are all scrolling through, your phones. But when those ads come up, that's what people see is the OHCC stuff. We're going to be slide right inside of there. I'm going to pause for a second because I see Paul has his hand up.
Hey, David, thanks for this good report. I was just kind of thinking, what about, I know we've done this, I know we're probably doing it, but the workforce, is that the work source locations, is this, I mean, obviously people could access, but is there any continued effort with the work source offices that are also, some people maybe aren't using social media as much or whatever, or maybe they're just not aware, but they may find it through work source is an idea.
Yeah, thanks, Paul. And that actually winds up with part of this. We also are connecting with lots of community organizations. So ERCO, for example, right, that help refugees resettle. They're helping our new neighbors resettle and find jobs. We've got information for them. We're calling them starter community toolkits. So they'll get packages of any type of information they need in the languages that they're requesting. So we'll be doing the same thing with WorkSource, along with also self-sufficiency offices, where they have talking points. And so they'll get a sheet with a talking point that says, hey, because this is, again, statewide and it's going to be commercials. And so if they call a self-sufficiency office and are like, hey, I saw this commercial, I'm interested in it, the person at the call center automatically has the information to then send them to the correct place also. So lots of partnerships going on in that realm, and getting all the WorkSource people there. We're also really pushing the provider navigator with this whole thing so that people know if they can right away, I can get a provider navigator to start me out through this process. Broadcast television also, so you may be seeing it when you're watching the nightly news on CBS or whatever, but we're going to be getting in there. We're going to be having commercials in streaming websites as well, so Hulu, because you still have to watch ads on Hulu even though you pay for it. Anyways, whatever, I'm not ranting. But all of those streaming services, right, as people have shifted away from cable as well, we're going to get over there. You'll start seeing ads on billboards, on bus transits, on the trains, all over the place. We've got them going. I mentioned public radio as well as we reach the rural communities and coastal areas, since those are used a little bit more regularly out there. I mean, I still listen to the radio, but whatever. And Paul, this toolkits for local teams and campaign collaborators, that's includes WorkSource and other workforce development boards as well.
I would imagine included,
Okay.
yeah, is, I know that we do this, but try to work with community colleges or some areas where there is training going on, or maybe some of the CTE, is that anyway, the even the high school programs where people are getting some training regarding caregiving, and I'm assuming that's all part of it. I believe it is.
Yeah, it's this has been a very extensive net casting going out. Yeah, even talking about how it can be a good toe in the water for healthcare in general, right? I like to tell people often, like, hey, even if you're thinking of being a doctor, like being a home care provider will build the people skills you need to help yourself be a better doctor in the future. So when I go out and do things like that, or even talk to just random friends, I mention that it's important for doctors, the higher up professionals, to have that experience when they come to the table as well. So finally, here's some of the ads that you'll probably be seeing around. Again, these are going out in Russian and Spanish at the moment. These are different ones. Some of these are posters that will be available in that community toolkit, blah, 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 community toolkit to then be placed around communities, within libraries, on job posting boards there, within grocery stores even. I was at a restaurant the other night and they had a community events board up there, and so posters could be there as well. I also went to my local bookstore and they have a job board or a board for community stuff. And so posters could go there, you know, with permission and whatnot. But all of this stuff becomes a little more flexible and doable with everything here, and a consistent message, right? These are some of the billboards that'll go around. You'll notice that it doesn't say OHCC workforce.org. It says OregonHomeCareJobs.com. We got a vanity URL, which, you know, makes me feel special, but a quick, easy thing for people to remember when they go and search for this. They don't have to think, oh, OHCC, what was that? What does that even mean? It's OregonHomeCareJobs.com. Quick, easy thing to tell people as well. And that's what I got for you. Any questions or comments?
Yeah, David, this is Commissioner Adams. On the one down at the bottom called the flexibility you need. I'm not quite sure how to tell you, but is that going to be in reference into flexibility that the state provider can have, or that the consumer that they're working for will have, give them the flexibility?
Yeah, so the message is that this can be a flexible work schedule as long as you communicate that with your consumer and you come to that schedule together.
Okay, because there's been a number, I'm pretty sure there's consumers out there that's not so flexible with their employees, and I just want to make sure that there's no false stuff out there on the flexibility.
Yeah, thanks for that, George. And that's one of the big things that we talk about, is that this is a job where you work with the individual and you have to talk with them and come to an understanding together.
I have seen some of these ads on Facebook.
Yay, all the way down.
I've seen many people having a reaction to them on Facebook so far.
David Paul has a comment in the chat.
Oh, go to the chat. Is there a way to put a code to scan with your camera phone, printed material? Yeah, that'll be the QR code. We'll have those all throughout the printed materials. I should pull up the website. Can I pull up the website real quick? Do you have time for me to keep doing this?
We do have our next guest speaker here.
Oh, well, okay. Next time I'll show you the some of the printed materials as they have come up and are available. My favorite one is what we call the journey map, which is just, it walks through for a home care worker, personal support worker, and personal care attendant. It gives them all the step-by-steps that they need to follow through on to end up working with someone. So I think that's my favorite one. It's a simple, easy visual, but then has an expanded 2-pager down on the bottom to answer that more in depth what each of those steps looks like. And with that, I will pass it over to Nate, mostly because he's giving me really dreamy eyes at the moment, and that was great. So
Wait, before that happens, I just want to acknowledge the work that David is doing on this project and the endless number of hours he's put into working on this project. And I want to thank you for that, David.
yay, thank you.
And I just want to acknowledge those look great. Like, you know, I think, again, communicating out and workforce from a previous life, just jumping in there for a second. Just love it all the way around. So
thanks, Nate. I appreciate that.
Apologies, folks. Nate?
Yes. So,
Yes.
Hi, everyone. James is here with me. We decided we'll both be here. So if commissioners are good with it, we'll jump in.
Yes, it's a 2-for-1.
All
What a
right,
deal.
James.
Yeah, well, I was all ready to share, but I see sharing,
Oh,
Heidi, you're sharing, so that's great. I'm
I
not gonna
can do it
plan.
or you can do it, James,
No, no,
however
you're
you
fine.
prefer.
Go ahead.
Okay.
So yes, I spoke last time. I'm the engagement strategies coordinator with OEP, and of course, Nate is our director. And this is what we're going to be talking about, but we might as well dive on in. And since I hope everyone has a copy of this, as of last week, the queue's have been short. Although I was taking a glance at today's numbers, and they're, it's the beginning of the month. I think we've got a wait time right now, if you called now, of about 13 or so minutes. But we've been in pretty good shape, but I guess as Nate mentions, this is a little bit of the slower time of the year. I don't know if you have anything to add about these times.
Yeah, say, at this point, we get to see a little bit more of history. So between March and the end of May, we see a lull in just our overall eligibility areas. So some just are the way the caseload is, we will have gotten through open enrollment in some of those areas. So we start to catch up. So in our system, we do tasks, and we have normally around anywhere from 50,000 or so tasks in there. We're around 14,000 right now. So I'm doing good. As James mentioned, it's busy today because today's the first of the month. A lot of people call to see status of benefits, when are things coming in. They need to now reapply because it's their month to reapply. So we just see a bit of a more demand during the first few weeks of the month. And I love what James put on here. So that QR code, you can shoot a picture of it, but it'll take you to a dashboard where you can see the wait time. So you can see historical. So if you are calling, that's there. As a reminder, you can still always go into an office or apply online. You can do paper applications. This really is about choice. So, but we know we've had many people choose to, or especially during the initial part of COVID, choose to use the one customer service center. So one of the things you can also see on that same page that has those dashboards on wait times is new applications, and you can search that information. You can see that it's pretty evenly spread. About 25% of the population uses phones, 25% does online, 25% comes in office, and 25% does other, which is a lot of different options. So, yeah.
Cool.
Go, James.
So here's our hot tip. Apparently, the number that people get their calls from the one system, whether it's about appointments or any sorts of things, there's some phones that have been registering it as spam. So just make sure the people you talk with that they have that number in their phone, so that that they receive the call and it's not automatically blocked on their phone. Any questions about that? Does that make sense?
And one area just to similar for this, if you're working with the Home Care Commission or any of the local offices, just double checking. So as spam filters have grown over years, for those of us that remember when phones, again, had a cord and were attached to a wall, but then had caller ID as a new thing. If you believe you should be getting calls, or a case manager said, hey, I tried to call you, and you're like, I'm not seeing these calls, this is just a common area to check. So this is the number that we will always be calling from, but you can think about your local offices and get numbers. Again, on our web pages are places you can find all the local offices numbers, but they can also help you in an office if that's ever happening.
Yeah, Paul.
Yeah, I don't know if this question makes sense or is worth it, but so if a call's made from this number and the individual, maybe they don't recognize the number, so they don't answer it, is there a way that it goes into voicemail? mean, is an individual calling on this number, or is it maybe generated by the system so that at least a message could be left, this is the one system with Oregon Department of Human Services. We tried to reach you or something so that they could recognize, oh, I missed a call, or I need to respond next time this number appears, or anything like that. Is that possible to do something like that?
Yeah, so Paul, absolutely. So when staff call out there, they are to leave a message. We don't leave a lot of information because some of our cases may be dealing with sensitive things. So we get permissions or they leave some of the vague parts. This is Nate Singer calling from the Oregon Department of Human Services. If you can give us a call back at here, or sometimes they'll say they'll be calling back. One of the pilots we're actually doing is we're building out. So we do something called cold call. So if we haven't been able to get a hold of you, you missed an appointment, we try to call you. Well, if you're like me, I don't answer my phone most times, even if I, think it could be a number. So we're automating text messages go out to say, hey, this is Nate Singer from Oregon Department of Human Services. I'll be calling in the next 5 minutes from this number. And we saw like call answering go from like 20% of calls being answered to 90+% of calls being answered with that. So we're doing that. And yes, we have automated voicemails that can go out. So they'll go out saying, hey, we tried to reach you from the Oregon Department of Human Services. Please call us back. We need to update your case, or we need some verification, or etc. So they say it better than I do, like James does. Everyone does. It's always better than I say it, but yes. And as you all do it, that's a place, again, from the Home Care Commission. If you all have areas you experience, and James leads this, we have the Oregon Online Improvement Committee, some of your participants. We talk about the online improvement, but if there's wording and notices, but also in our voicemails or processes that way, please continue to inform through those groups, or let us know through these groups. Jenny is a fierce advocate for you all as well, and can quickly get a hold of us and say, hey, everyone hates X or Y. You can tell us something nice, that's fine too, but usually we want to know how we can improve. So just flagging that out there.
Thank you.
Right, yes, and Commissioner Adams, one of our co-chairs on the OIC. So always happy to hear your voice. But yeah, and I love to talk about the mobile app. I know it's not for everyone, but for those who have smartphones and want to track their one account, this is a great way to do it. There's lots of different features we don't need to get into right now, but I just want to make a plug. If you look up in any of those Apple or Android app stores, Oregon One Mobile, you will find this. You can't apply with it, but it gives you reminders about appointments and other things. And so just a happy little plug here I wanted to put in. And a new feature that just started, we didn't do a big announcement for it, and I'm sure Nate will have more things to say about it, but I'll just say that now there's a couple different things, well, maybe 3 technically, that you can do without actually talking to a person when you call the customer service center. And so we're pretty excited about it, and it's, as with everything, there's little bumps, but it seems to be working well. I don't know, Nate, you have more on that?
Yeah. So if you call that 800 number, this is a chance to, it is integrated voice response. So you can talk or push, buttons. You can always say agent, operator, talk to someone, hit 0 to, bypass it. But if you just want to know the status of your application, I submitted an application, it can let you know, oh, it's been approved, or it's pending, or, theirs. We see regularly people requesting their EBT card replacement, so they can sit there and say, I lost an EBT card. You can always go in an office and they can issue one live in an office, but if you need an EBT card for your SNAP benefits or for any of your cash benefits, and you lost it or just need a replacement because it's bent too many times, one, you don't need to bring the card into the office anymore, but you can also just call the line, and you don't even have to wait for a worker. You can just request it and it'll go through there. So we have seen thousands of people use this now to go through it. So it's being used heavily for people to just get what they need.
All right, and our last topic here is also new that that started in March. There was legislation that required us to ask more detailed questions about sexual orientation and racial identity. These questions are optional. They're not optional for us to ask, but they're optional for the client, the customer to answer. And so this will allow us to look at this data more because these groups exist and discrimination exists. And so we want to make sure that we're serving everyone equally and doing this well. And so that's part of the point of this, besides the fact that by law we have to do it.
Yeah, and I just want to share briefly, there's a lot nationally changes that go to this. We are complying with both state and federal laws. So we collect information on race, ethnicity, language, disability, sexual orientation, gender identity, following state statute and law. And as mentioned in here, we're required to ask it, but it's your choice to say, I don't want to answer. And that is absolutely fine. And we will document that and go towards it for whatever reason. You don't have to give a reason why you don't want to. And so we ask it. The sexual orientation, gender identity are for individuals 12 and up. So it is collecting there. But we also collect, as I was mentioning, male and female information. So you'll see sometimes you're like, didn't I already answer this question? We're asking the questions to get to it. And to James' point, the intent of this is not to send it out. We don't send it out to a bunch of federal partners or other things. It's for internal areas for the state to really say, who are we serving, who's accessing our benefits, and to be able to ask questions if we can improve equity or access for people, again, coming in to apply. So I think those are all of our updates. James?
Indeed, that's it. But if there's other questions or concerns, I think we have a minute or whatever our facilitators will allow. But if there's any other comments or questions. Oh, well, I guess I'm sorry, here I am looking at the screen. I always like to make a plug for this partner page as well. Just something for community partners to have resources, how-to videos, outreach materials, and the like as well. You can find it at that link, or I can put it in the chat as well.
And I will do my quick plug. I use YouTube to do everything now. So if you ever need to fix something, my dryer broke like 7 times and I was able to keep it going a lot longer because of YouTube videos. So this is very similar. They are how-to videos. These how-to videos are things like how to do things with your online account or other things. So we're continuing to try to build out a library of resources. Again, an opportunity, if you sit there and say, hey, it'd be really great to explain how to do this or that, please again share. Another place that you all can inform. And, as James shared with Commissioner Adams, George, you have someone that sits on OOIC too. So bring in items. We're always glad to try it. And you all were already showing off with some of your great graphics and materials there for the Home Care Commission. So we want to continue to try to do similar to, again, help choice.
This is Commissioner Adams. I do want to say that it's fun to work with James. It's fun to work with this committee. We have a lot of fun. A lot of hard work goes into this, and I'm happy to be part of it.
I love hearing that, and I love the things that you all bring forward. There's a change coming in the future that James will come and be able to talk to you about around self-scheduling. That comes from areas for it to get into the one system. There's identity proofing, which is good for security, but really painful to go through there. So some changes are being looked at around that. Again, it may not happen quickly. And with the federal changes that are, being floated out there, we don't know what everything will look like, but your voice really does help us prioritize. When it comes in there and it came from this committee and from you all saying it, it carries a different weight than someone like myself saying, do we think we should do this? So thank you all.
And that's in general, one thing to remember about the one system. We're constantly improving it, but everything that we want can't get done at once. You know, it's coming along, and work of the committee has been really important to help us prioritize and move many of these items forward.
One more thing, this is Commissioner Adams again. James and Nate might want to say something about recruiting. We are looking for more people, aren't we?
That's true for the one online improvement committee. If this is something that you are interested in, spending a couple hours a month with us, talking in depth about the one system and making some of these changes to make it work better, I would be happy to talk with anyone here.
You know, I think I'm going to be very transparent that the Home Care Commission really was what I was trying to steal when James took it and made it. It was, how do we get the voice of individuals in the communities that are using our systems from various places? And so you all have always been such a great advocacy group, you know, so engaging and so leading inside these areas. Appreciate you coming across this group. If you know individuals, if you yourself are interested, it really does help us. And it really does help us know what is the priorities, what is working, what isn't working. And so, again, James mentioned, doesn't always happen quick, but it happens. And it happens because of you all. So thank you for anyone interested. And we are always excited to engage. And I appreciate James for his work. He engages a lot around these areas. He's constantly looking for improvements. And then he has to deal with people like me that's trying to say, do we have dollars? What else did the legislature or the federal government making us do? So just thank you. You have a great advocate with him there.
Thank you, Nate and James.
Yes. Thank you so much. And now I do believe. Oh, no, we do have one more thing. I didn't have the agenda in front of me.
Marcia, we have the Oregon Council on Developmental Disabilities, and Brent Watkins is presenting.
Okay.
One of my
thank
former
you.
managers.
Oh, well, you
Hold that against me.
no,
Not at all.
we'll be gracious.
Great.
Okay.
Well, thank you for having me here today, and I recognize our
Thank
time
you,
is
sir.
short. So I may skip through a few of these slides and just provide some summary information. So for those of you that may not be familiar with the Oregon Council on Developmental Disabilities, our DD Council, as often we're referred to, has been around since 1974. DD councils or state DD councils have been in federal statute since 2000, and the majority, if not nearly all of our funding comes from a federal funding through a federal grant award. We report currently to and receive all of our federal funds through the Administration on Community Living. You know, really one of the primary purposes of our council is to identify gaps in our systems. That could be state policy, legislative policy or rules, as well as agency policies and rules, and to really provide advocacy to make sure that the voice of people with disabilities or developmental disabilities and their families is amplified, and that we're addressing those the needs that they have. Just so you understand the composition of our council, 60% of our council by federal mandate must be comprised of individuals with disabilities and families who have children or have a relative or a child with a disability. Additionally, we have federally mandated partners that is on the next slide. You can see those there. So that would be Office of Vocational Rehabilitation, the Office of Developmental Disability Services, the Department of Ed, Oregon Health Authority. There's Maternal and Child Health, which is a Title V program, aging in physical, or I always want to use the old term, but it's aging in people with disabilities. And then our protection and advocacy organization, which is Disability Rights Oregon. And then our UCEDS, which is University Centers of Excellence for Developmental Disabilities. And that is the Oregon Health Science University and the University of Oregon. I won't necessarily go into the length of terms and all of that, although these are governor appointed, non-Senate approved council members that serve for 4 to 8 years. So each term is 4 years. We have 2 officers, a chair and a vice chair, who serve for 2 years, but can serve up to 4 years consecutive terms. And currently our chair is Kelly McCauley and our vice chair is Eddie Plurd. Both of those individuals are people with lived experience. In terms of how we fit into state government, it's an interesting relationship. Because we're federally funded, we're required to be essentially independent from government and the decisions that we make. However, through interagency agreement, we are state employees, and I directly report to Dana Hiddle, who is the director, the interim director of the Office of Developmental Disability Services. Primarily what's provided by the state is some in-kind support. So they provide human resources for us around payroll, hiring, and those sorts of human resource or HR activities. And they also provide us some support around invoicing and bill pay through the Office of Financial Services. And then they support us with contracting and requests for proposing proposal drafts. So if we're going to contract, then they help us with that process as well. So under the,
Sorry, am I going too fast, Brent? Just let me
no,
know.
you're doing fine. Actually,
Okay.
I'm probably going too fast for you.
No, it's fine. We're flexible, so.
Yeah, I was going to go through and talk about the federal legislature or the federal statute that put us into law, and that's what you may hear referred to as the Developmental Disabilities Act or the DD Act. And there are some very specific things that DD councils are required to do. So, Heidi, if you want to move to slide 11.
There you go.
Yeah. So you see here that the purpose of the DE Act is to assure that people with disabilities and their families participate in the design of and have access to needed community services, individualized supports, and other forms of assistance that promote self-determination, independence, productivity, integration, and inclusion in all facets of community life. So what does that mean? It gives us really some direction in terms of the types of things that we're looking at in terms of our services in Oregon providing needed community services, and if they aren't, what's not being met. That also relates to the individual supports and how our state does in terms of assisting to promote self-determination, independence, and all of those things. There's a variety of ways that we can address some of the gaps in that if we find them. Sometimes we do that through contractors. We do it through work groups. And we also participate in work groups to share that perspective. And we really support individuals and families to be able to do that for themselves so that it isn't being staff-led, but that it's being advocate-led. Go ahead and forward to the next slide.
Mm-hmm.
These are really our primary activities around advocacy, capacity building. And I would say that capacity building also means leadership building, so that we're looking to build leaders among those with lived experiences and their families, and then identifying systems changes. And I'll give you one quick example of a systems change that we're working on. So those of you that have been working if you've worked in developmental disability services ever, you're probably aware that there's always been a bit of a disconnect between behavioral health or mental health services and supports for people with intellectual and developmental disabilities and that system as well, the IDD system. And so a couple of years ago, we entered into a contract with the National Association of the Dually Diagnosed to really do outreach to Oregon, to people that receive those services to understand what are the challenges. And so recently they released the report related to that contract. And it came with a number of findings and recommendations. And just so you know, very soon, that report, it's available now. You could ask me for it. I'll send it to you, but there will be a message that comes out shortly from the ODDS director's office, letting people know of the report and the findings and if they have any interest in it. So those are the sorts of, there's a lot of different system changes that we're involved in. We're actually part of a Medicaid coalition right now that's looking at different ways that we can support people for sharing their stories and their concern about potential Medicaid cuts. Go ahead and advance to the next one. So these are examples of our advocacy activities. I want to highlight number 2 particularly because this is something that we are currently really engaged in. And something that we do pretty regularly. And it's not just state legislative testimony. We also support people that want to engage in federal politics or federal legislation and helping them in writing or sharing their stories in a number of different ways. It may be that we provide them support in terms of structuring how they want to share that information. Sometimes it's providing support around video testimony or messages that are recorded. So there's a number of different ways that that happens. And of course, it's always done in an accessible way in which the person can participate. And of course, also then educating policymakers about people's stories. And so we do a lot of outreach related to some of the state legislation and saying, hey, these are bills that are out there right now that impact people with intellectual or developmental disabilities. And if there are people that would like to share their story with state legislators, then we do our best to support people. As a council, we have to always take a neutral stance in terms of anything that we might provide in terms of testimony or impact. We can't tell people what they need to say, but we can support people in sharing their own stories. I think just for the sake of time, these slides are available. I'm sure they can go out, but these are the different ways in terms of trying to build capacity. Capacity really is making sure that people have, that we're providing different ways in which people can engage in the process and their voices are heard, that we're helping people to develop leadership in our community. And then, of course, as I talked about, if you go to systems changes, there's the number of different ways in which we try to support people in affecting changes to our system that would be positive and supportive of people with disabilities and their families. So I see we are out of time, but I can stick around if there's any quick questions that people may have. I want to be sensitive to your schedule.
This is Commissioner Adams. I want to tell you, really glad that you are in this position and doing this type of work. Really appreciate and everything you do in this department.
Thank you. I appreciate that. And I will add, one of the things that we can do to support is, like I said, one of the things that we are responsible for is providing opportunity for people to engage. And so information that may go out that may be important to individuals with developmental disabilities or their families, if we have that information, it's Joanne Reganathan, who is our communications person, and we can put things in our different social media accounts. We can put it out through our email list, and there are places that we can even include occasionally things on our website. So just a plug there for partnership.
And I did send this out to Jenny and the commissioners, Brent, so they have it.
Yeah, great.
Uh, Brett, this is Marcia Wetzel, and I'm could you send a report you were speaking of earlier to Jenny and she can share it to the
Absolutely.
commissioners? All right, and I'm looking at the last slide you have up about all the information you have available regarding DD.
Uh-huh.
It might be very useful to send it to David Vining in the commission, who currently heads the DD Mental Health Committee.
Oh. Yeah,
And you
maybe
can
if I
get it
send it
to,
to if I send that to Jenny and Heidi, is that something you could get to the right person?
Yes.
Okay.
okay, that
Aw-
would be very useful to them.
Yeah.
Mhm.
My
Thank you.
hope, honestly, Marcia, is that this report becomes sort of a launching point for us to engage in sort of a collaborative conversation about how the systems and the programs can work together to address some of the concerns.
Thank you.
Brent, this is Jenny. We're very excited you're here. One of the things that the commission would really like to be more involved with are issues that impact individuals with lived experience through the DD system. And we're really wanting somebody, an individual who receives in-home services from a personal support worker, to join the commission as a commissioner. We want to have that representation. We want to advocate for individuals who receive services from personal support workers. And so we're really, really interested in seeing how we can collaborate together. And then I'm not sure who's on the DD Mental Health Committee, but there's also room on that committee too for individuals who receive services through the mental health system or through the Office of Developmental Disabilities, or their family members who want to have some sort of influence in the work that the commission does. We have this subcommittee of the commission. And Paul, I'm going to put you on the spot. I know this is very much of interest to you as well, if there's anything you want to bring up.
Yeah, well, I would just agree if we could, we regarding the having a representative from Oregon Disability, that would be terrific. Getting that voice, having the perspective shared, the input and interaction, we've kind of been missing that for a while. So I would just affirm what Jenny just said.
Yeah. Just a follow-up question, Jenny. Are you looking for someone who also serves on our council, or just someone within someone with lived experience within that receives services through IDD to participate or to be a commissioner?
Anybody with lived experience
Okay.
would be great. And then if we can continue our relationship with you and maybe have you come and like report regularly,
Yeah.
like maybe every quarter about what, the council is focused on. And we would be happy too to also share information at your meetings.
Great. Oh, that would be fantastic. So yeah, I have some ideas about people and where I might go to promote the idea of a person with lived experience applying to be a commissioner. So I'll follow up with you on that.
That'd be great. Thank you.
Hmm.
And Paul has his hand up.
Yeah, just Brent, one other idea too that we talked about when we talked about our strategic plan is to just form deeper, I don't know what you want to say, alliances with like-minded or commissions, organizations, or boards. And I'm not proposing anything right now, but we could consider, maybe having a joint meeting sometime, or discussing, maybe identifying some topics that would be between your commission, your group, and ours, just for cross-pollination and
Yeah.
learn other. Um, and we've talked about maybe doing that with some other groups. We don't want to get siloed, in just what we do, especially when it comes to learning and participating with others. So those were some ideas, Judy, if you don't mind me mentioning that we've talked about, and maybe this would be a good start.
Great. I love that idea. You should know that one of the things that is most important to me is recognizing that it's really collaboration. You know, and I love that you talked about avoiding siloing, Paul, because the reality is that we're a community, right? And because we're all part of the same community and may have some slightly different roles in community, it's still is important that we connect as a community and understand what we're all doing in community. So I'm very happy to hear that, and that's something I would be excited to pursue.
Anyone with further questions for Brent? Well, thank you so much. I've learned a lot. Thank you. And
Yeah, thank you so much.
Thank you.
And this will continue on. Thank you for
Yeah,
coming.
if it's okay, why don't I very quickly, I can put this in the chat, I can also send it, but let me put my email in the chat. And that way, if you want to reach out directly to me, you can do that as well.
Thank you.
Yeah. All right. Well, thank you for your time today and letting me join. I think this is, in the words of our friend, I'm going to forget his name now, huh? It's like one of my favorite movies. It's Louis, right, from Casablanca. It feels like this is the beginning of a beautiful friendship. So I'm happy to be here today.
Yes, we're very excited. Thank you, Brent.
Captain Renault. There you go.
Okay.
Thank you, Brent.
You bet.
Good to see you.
Goodbye.
You too.
Bye.
Bye-bye.
Well, it looks like we have reached the end of our agenda. Tis true. I can't see it
Yes,
right here. But
that was
all
our
right.
last presentation.
Yep.
Okay. Anyone have any further things to say before I adjourn the meeting?
No, Jenny and Heidi, I'd like to talk to you on the side with no recording.
Okay. So I will adjourn. Oh dear. The meeting at 1:10, and the next meeting will be June. Help me, Heidi.
June 5th.
June 5th.
June 5th. Yep.
Okay. All right. Thank you so much.
Thank you, everybody. It was
Thank
great to
you.
see you.
Goodbye, all.
Bye-bye.
Happy Mother's Day.
Bye.
Oh,
you.
Bye, Commissioner
good.
King. Take care.
Bye-bye,
Mhm.
Mark.
Heidi, will you stop recording?
Yep. Let me try to stop this thing. And interpreters, thank you for staying later. Thank you, Melinda and Heidi.
Good day.
I'm trying to stop this recording. There.